This is Manong George, and today I'll share to you my experience working in the wards.
Are you ready to pass the NMC OSCE the first time as efficiently as possible? Then you're in the right place. Here at IATS Medical, we've seen adult nurses through to a first-time OSCE pass ending last year with 98% first-time pass rate and 100% second. We've also assisted mental health nurses, children's nurses and midwives through their OSCE exams too. Accessible OSCE practice rooms and expert-led courses. Our nurses are not only passing their exams, but they're having fun doing it too. Inquire today about how we can assist you too.
So today I'll tell you about my experience working in the wards. Just to give you a little bit of background, it's a 12-hour shift that I normally do back then when I used to work in the wards. And I'll take you on a little journey on how my day goes. So I arrive in the ward at around 7 in the morning. 7 in the morning, you try to make a little cup of tea, or maybe even just go straight into the handover room to receive handover from your outgoing team. Little tip, when you receive handover, make sure you prioritize what you need to do. Make a little list on what is very important for you to accomplish on that shift. Maybe somebody's going to theaters first things in the morning. You may have to make sure that this patient should be ready to go rather than putting them down on the list. Also look out for any special medications, special handovers that have been sent, that have been passed on to you by the outgoing nurses. They might need to be done very early in your shift, so make sure you have that. Other special handovers who might be going home, was there anything that they need for that day? Or is there any special handover or endorsement on how they are going home? Probably your handover has been done. Now it depends, some institutions that I've worked for, what you then do, and which this is something that for me really works, is that you walk side to side with the outgoing nurse, and then they could physically point out, handover what might be physically in that bed or ward. Perfect example is maybe they could put out, oh, you see this cannula might be due today. You have some antibiotics to give later in the midday. It's up to you whether you need to change that now or maybe change it later. So little things like that would also help. Drug rounds. During drug rounds, what you want to do is you don't want to be distracted. You have to wear an apron that says you're a medication nurse, so please do not disturb. So make sure if you have that sort of apron, wear that so people are aware you are doing something very important. Or if you don't have that, make sure you're focused on your drug rounds. What you don't want to do is feel or be too rushed that you don't actually do your checks. You have to do your checks for your patients. Look at their armbands, double check if that's the correct patient, and also you don't lose track of what you're actually giving. Make sure you do your observation, whether it be hourly, 2 hourly, 4 hourly, or 6 hourly. Make sure you do that. So what I would say at this time, again, go back to your list of priorities. Maybe what you have to look at is that, for me, if there is somebody going to theaters, by this time, I have done the checklist. Do the rounds with your consultants or whichever doctor is making a rounds. This way you are aware of what would be the plan for your patients, whether or not treatment might be continued, discontinued, or changed, or let's say maybe even you are looking to discharge this patient, then you can make appropriate plans. Unfortunately, not every day is the same for most of us nurses, so you have to always be ready to receive news of what would be the next step, and you should also welcome change, because change just happens like that in the wards all day, every day, at any time. So we're now moving to the nitty-gritty, the busiest part of your day. You are now probably coinciding with doctor's rounds, patients going to theaters, but there's also helping out maybe in breakfast if a patient would be struggling to eat, or maybe even if you have to look into helping out with hygiene care for patients. I'd say that time from 9 to maybe even around 11 o'clock, this is what you're looking at. This can be quite busy. You might also be getting some other patients that might need other procedures that might not necessarily be surgery, i.e. endoscopies, different modalities of scans like X-ray, ultrasound, CT scans or MRIs. So most of this happen on that time. But if you are lucky enough wherein you've got enough staff that can cover, right? Or you don't have high impact wards, maybe this might be a good time as well to get that 5 to 15 minute break to maybe just sit down for a second, have a cup of tea, have a sip of coffee, just check where you are with your list and compare that with what's happening on the day. If by this time you've caught up with everything that you have to do and you think this is a good time to sort of settle down, yes, if you can insert writing your first set of notes just to say what happened in the morning, great. But if you can't, what would be the next step? Drug rounds. Do your observations. Also look into preparing your IV drug rounds. Normally, 2 o'clock would be the regime for IV medications in the afternoon, so you have to be prepared for that. If you're lucky enough not to have any IVs, then you could look into, again, writing notes. If on lunchtime you've got patients who need help with feeding themselves, maybe this might be a time for you to go for your long break. This might be between 15, 30, or even 45 minutes, depending on how your ward setup is. But this is a good time to at least get in your lunch. Always remember, if you still have to do your breaks, you have to make sure you hand over well to somebody else qualified so that your patients would still have the same care. Be the time now for some of the patients that you probably sent to theaters to be coming back. So make sure you are able to receive them. Also, depending on the rounds in the morning or what the plan is for that day, this might be the time that you start looking into discharging patients that are able to be discharged. So what you want to do by this time is that if you can coordinate them depending on their needs with other teams like OTs and physios, you have to coordinate that with them. Or if you have to coordinate with the discharge team for extra package of care once they're home, you have to make sure you're making contact by this time, if not earlier. What you're looking to do now, if you have the time, is to write some notes. Also, this would have been the time normally wherein patient relatives are allowed to come in, so you give them their time. All right? You might be asked already if you can take in new patients. Obviously, if you have space for patients, then yes, you will take them. If you don't have the beds and you have patients to be going home within the day, rest assured the discharge coordinators will make your bed availabilities a priority. Do your observations. If there are new plans of treatment that the doctor has asked to proceed with, let's say they want new bloods or whatever, if you can do the bloods, this would be the perfect time to do it if there's a bit of downtime. Drug rounds have the suppers as well. So again, you'd have to rely on your team to make sure that everybody knows what they can do and what they're supposed to do within this time. Hopefully by this time you have finished your medication rounds. So what you want to do is to ensure that you have started taking notes for handover to the next shift, but also make sure you have done your full documentation for the day. One thing that is very, very important to remember, if it's not written, it's not done. So one thing that you can never hand over to the next shift is your notes. Probably if it was a busy day and you weren't really able to give out all your medications including IV, and if there's a delay, you can be forgiven if you need to hand that over. But you cannot expect the receiving nurses to write down your notes. So make sure you can write your notes. You do the same thing. You now in turn hand over with your colleague what is special on that day, what is expected, and what is the treatment plan. Between 7 to 8 o'clock, if you're on the day shift, you'd be going home by this time. You're coming in for a night shift probably either at 7 or 8 p.m. And similar to how you do your day shifts, you receive your handover. You do the walking rounds, if you have such, with your colleague to see what would be needed on that night shift. Now, on night shifts, what you want to do is to make sure that once you receive it, the ward is in order. If this is on the tail end of other patients' supper, then yes, you want to make sure that's all cleaned up. You want to make sure as well that you know your numbers. What do I mean by that? You know if you have any patients coming in from theaters. You know if you have any patients coming in from A&E, maybe potential patients. Also, you know maybe if there are patients still awaiting to go home. And also, more importantly, when we talk about numbers, you also know your numbers to call. Who's the on-call doctor for the night? May that be medical or surgical resident on shift, or who is the bleep holder for support for nurses. You want to make sure that the patients are ready to be relaxed and to have a restful night. You want to make sure that your patients are well tucked in to sleep through the night. Part of their stay in the hospital is that they could recover well as well. Make sure, by the way, to check on your observations. Just in case if you're missing anything, make sure you check all the observations or vital signs of your patients. Sometimes at this time, you would also have doctors who are on the night shifts doing their rounds. Make sure you always get their numbers to call, just in case if anything happens in the night. Talk about breaks. No, you don't sleep at night. Depending on how your night goes, between that time, you want to give your patients their time to rest. However, every now so often, if not hourly or every 30 minutes, you look into your patients at night shifts. Look if they're breathing well, if they're at any discomfort, if they're at post-op, are they in any pain? Anything under the sun that might happen, you should be aware. You should look out for them. Do your observations. You should start preparing your medication rounds at 6 in the morning. Drug rounds, important time for you because by this time, if there's a patient going for theaters, you have at least prepared what lists, checklists, documents they would need to go to theaters, and if they have pre-op medications, you probably would have to give them, including, this may include starting a line. So 6 o'clock medication rounds, and also putting in lines would be best done by 6 in the morning. Probably handing over to the morning shifts. You have to make sure everything's done by then, and if there's any other jobs that needs to be, if you didn't manage to finish it over the night, this is the time you hand it over. And now, good morning. So that is then 24 hours in the ward with me, Manong George. I hope that I've given you some insights on what to do and how do you do it in the wards. Mind you, I've worked as a nurse over 10 years, and a good part of that, my experience, is working on surgical and medical wards. Make sure you support our website, FilipinoUKNurse.com. The link is down below, and if you want to contribute to our cause, if you know how to write, if you've got something to say, please make sure to send us an email on our website, which is again down on a link below. Always remember, Manong knows.
Manong knows best, put your worries to rest when